Yeah, so we now go to the second part. I've already introduced Dr. N. Sathian. Over to you, Sathian, for this important talk on consent and its cruciality.
Thank you, sir. Good morning, everybody. I thank AOS, APOA, and Nirmal sir for this opportunity. I am here to talk on consent and its cruciality in our practice. So, what is consent? It is an agreement, compliance, or permission given voluntarily, very, very important, without any compulsion. In medical practice, it refers to a willingness of a person to subject himself for examination, investigation, or treatment. And more than your skill set, you are no more considered as God. So, consent is very, very important. Without a consent, never ever touch a patient, do a procedure, or operate. So, consent started in 1947 with Nuremberg Code, then Declaration of Helsinki came in 1964, released by World Medical Association. And according to our 1872 Indian Contract Act, there was a proportion for consent. So, what are the types of consent? It is implied consent and express consent. And under the express consent, you have verbal or oral, written or informed, blanket, and third party. So, what is implied consent? Given automatically by the patient by virtue of his action. Moment he walks into your clinic, he has implied his consent to get examined. So, implies that he is agreeing to be examined. Only for procedures like inspection, palpation, percussion, auscultation, or just rolling up their sleeves for blood withdrawal, and not for any interventional procedures. Don't ever think that he has come to your clinic and can start doing procedures or a minor procedure or an intervention. Coming to the express consent, verbal, specifically stated by the patient in his own language, for relatively a minor examination or therapeutic procedures, like in case of ophthalmology, like syringing, appellation tonometer, gonioscopy, all can be brought under. You have to tell them that I am going to do this. I am going to touch your cornea, do an appellation tonometer, touch your cornea, do a gonioscopy. I am going to insert a syringe to do a ducting or a syringing, and that is verbal consent. And you need to have a disinterested party like a nurse or a relative with them during that procedure. Then coming to the written consent, for all major and diagnostic or therapeutic procedures like surgeries and anesthesia, you should have a valid written consent. And if you are doing any research, then participation in medical research needs also a consent, and it has to be in vernacular language, both in English and your local language, or the language which patient understands or knows how to read and write. Then coming to the doctrine of informed consent, condition, or it should have following in it: condition or nature of illness, procedure or the treatment proposed, risk and benefits of the treatment, alternative treatment and the risk and benefits, and prospect of success or failure, that is prognosis, prognosis of absence of intervention. If they are not ready to undergo that intervention, what will happen if they don't undergo that intervention, and acceptance or refusal or informed refusal for the said procedure intervention should also include in the doctrine of informed consent. So, a doctor should have multiple ways of explaining therapy, alternatives, benefits, harms, risk, etc. It might look very complex, but it is mandatory, and the level of understanding of that procedure and the risk associated with that procedure will be examined by the court of law when they have a case against you. Sorry. So, what is Bolam law or real consent? In case of informed consent, it is the doctor's responsibility to disclose the necessary information to the patient, but what court expects is a real consent, where apart from the procedure, you have to also explain the risk associated with that procedure, which they consider as a real consent. So, you should have three things: elements of real consent, should give voluntarily without any correction. Patient has the capacity and competence to give consent. They should be mentally stable to give that consent, and they should have an adequate level of information about the adequate level of information and adequate level of understanding about the procedure. And aging of consent less than 12 years, consent is invalid if the child signs a consent form under section 90 of IPC. Parent, guardian or person in whose custody he or she is can give a consent. 12 to 18 years effective consent they can sign, but level of understanding is very, very important. More than 18 years, any person with sound mind can give a consent. So, consent in emergencies, failure to get a consent during a medical emergency, like you have a globe rupture, corneal tear, something like that. If patient is conscious, you can get a consent. If the patient is not conscious, you have a road traffic accident where you need to treat the cornea, then it is not, if you don't get the consent, it is not amounting to any battery. Medical or not the legal considerations are important in life threatening situations. To take a written opinion from expert colleagues and at least get a signature from the next of the kin possible, police or the hospital in charge in case of an emergency. This is a famous case between Dr. T.T. Thomas and Srimati Eliza, where perforated appendicitis was not operated by Thomas since there was no consent. So, patient had a problem, and then he was held liable because he didn't do the surgery during emergency despite not having a consent. So, rules of consent, it should be free, volunteer, clear, intelligent, informed, direct and personal. Ideally in his own handwriting. Printed format can be a uniform format, can be printed formats, but rest other thing, specific risk, specific complication explained should be in their own handwritings or your handwriting, and they should read and write and sign it, and it should be procedure specific and person specific. See, you cannot get a consent under your name for somebody operating on that patient. See, you have a visiting consultant, like a retina consultant visiting you, and you cannot sign for them instead of a retina consultant. When person undergoes a retina procedure and done by the retina consultant should sign the consent form, not you. So, it should be procedure specific and person specific, and consent for each procedure. Like you are doing a cataract, somebody else is doing a retina procedure, you should get two consents. If I am doing a trab with cataract, I get two consents, one for the cataract, one for the trab. So, it should be procedure specific, separate, leave out blood transfusion. Insane and intoxicated person, somebody not very with acumen, then unable to understand the nature and consequence, consent is invalid. So, you have to get a sign of the accompanying person and all those things. So, this is one of the famous where patient was taken up for a laparoscopic inspection, and they found a problem with uterus, and consultant came out, got a consent from the mother of the patient and did a hysterectomy and oophorectomy. So, that is invalid and the doctor is held liable. So, consent of spouse is not necessary for any treatment other than performing sterilization, and these are all for general thing. Consent is invalid if it is not an informed consent obtained by misinterpretation, representation, fraud, threat or violence, under sedation, failure to get proper information, no legal capacity to give it, a minor or insane person, different procedure, different physician. And in ophthalmology, which is not negligent, which is negligent, if you have a nucleus drop, if you don't have a thing to facility to operate immediately or retrieve the nucleus immediately, that is not negligent. Not able to calculate the exact IOL power, not negligent. Dislocation of IOL, then patient not following instruction, not compliant, then resulting in a complication, you are not liable. YAG laser leading to causing RD, not negligent. MI during a minor procedure, drug reaction, and not identifying the drug reaction and is an offense, but having a drug reaction is not an offense. Adverse events due to product issues like IOL, consumables, Visco, BSS solutions, you are not liable. But when you don't have a valid written consent, it is a negligent. B scan not done for a mature cataract, end up having a noting an RD later is a negligent. Failure to record vision, IOP, duct, blood sugar, BP, and if any fitness required, it is a negligence. Consent for one procedure performing different or additional procedures. Failure to perform emergency procedure or surgery. failure to identify drug reaction is a negligence, and not having a required license, as Nirmal sir said. Lot of hospitals had a problem because they didn't have the pollution control board or as a clinical establishment act to do the procedures there. So the compensation ranges from 2 lakhs to 1 crore. Recently, failure to detect retinopathy of prematurity, the patient was given 1 crore as a compensation. So compensations are increasing leaps and bounds. You should be very careful. So we did convert our AIOS English to Tamil, and you can see consent in all languages of your choice, and do use those consent both in English and your own language. And as sir said, we have released our contents there. Thank you.